So what is the patient voice? So the patient voice is a very intentional way to ensure the patient perspective is captured throughout a healthcare organization. And it's not just about the patient voice being heard, but it's a patient voice actively participating in development of healthcare services, medications, medical products, etc. If patients are actively involved in the disease community, it has potential to elevate the expectations of the whole community. And if I look at one tangible benefit of that is I look at research funding. So I think if you look at the areas that have very strong patient advocacy, they also have pretty strong NIH research funding as well. Starting with HIV, when that was first diagnosed, for many of those people that had that disease, it was essentially a death sentence. And through very effective advocacy, working with both the government, the pharmaceutical industry, and other stakeholders, through their advocacy, they've taken what was once a fatal disease, they've turned into a chronic disease. It's improving patient outcomes that are in the best interest of the community and the patients have an active role advocating for that. And since patients are involved and now another stakeholder, that increases a chance for innovation in a field that needs it.
Having been a dialysis patient for 10 years now, I think it's extremely important for physicians to engage patients in decisions. Whenever I'm talking to patients about treatment modalities, I always say, it's your car. You've been driving it all this time. So we have to respect where you want to drive. When physicians understand that patients do have an understanding, we do think clearly, we are capable of making decisions, you empower us then to be in control of our lives. When patients are in control of their car, usually they won't drive over a cliff. What I have found about delivering patient education is that when a patient initially finds out that they're going to have to do dialysis, they start getting bombarded with all kinds of information at one time. I think if you just kind of ease them into this big change in their lives, it's more effective. One of the things that probably galls me most about patients finding out that they're going to have to do dialysis for the rest of their lives is that they don't hear about all the options available to them. And they seem to be shoved into one thing that's convenient, but who is it convenient for? And if it's not convenient for the patient, then it's not convenient for anybody.